My mom had had a bout of cancer, but not breast, and she recovered fully from it. But it was not on my radar. In fact, I think that's part of the reason why at 48, found a lump, ignored it. I just ignored it. And too busy mom, 3 kids. I was worried more about taking them to the dentist and just kept thinking, oh, that'll go away. That's nothing. At 49, I was diagnosed with stage 3 breast cancer. You have to come up to speed really fast in order to make decisions about your treatment, and that's tough. That's very stressful. I think that's part of the one of the difficult emotional parts of it is you've got to decide on this or that, which doctor you're going to go with, where you're going to receive treatment, what it's going to be. You're waiting for information. All of those factors around the initial diagnosis make it very difficult. I know I was a bit of a non-medical person. Rarely ever went to a doctor, and I was into using homeopathic medicines with my children and acupuncture, and I thought that would be all I'd ever need. So yeah, I had doubts. In fact, I did talk to friends of ours who, he's a surgeon, to ask whether the surgeon who had diagnosed me had really got it right. I was doubtful. And then when they said I needed to have chemotherapy, well, I just thought, this has to be wrong. This couldn't possibly be me they're talking about. And no, I'm not going to do chemotherapy. Why would I ever do that? That's got to be worse than the results you could get from it. And so I had to really come up to speed on, what cancer was about. And there was a point where I felt like I was on information overload. And then I had to kind of pull in and just take the next step. Okay, what's the very next thing we have to do? It might just be getting to the oncologist for your next treatment, and you just can't really think beyond that. That's the next thing. Because at the same time, your life is going on, and partners, friends, parents who are concerned about you, and they all want information. They want to be kept up to speed. That in itself takes a lot of energy. You're trying to find a way to communicate with all these people who love you and are reaching out, or who you just want to make sure they're informed. And it is like a job, or taking on a huge extra task in your life. For some people, deciding on their treatment course, it's not as clear cut as it was with me. There's a little more gray area, and so that would be very difficult. In some ways, you're deciding on something you're not an expert on, but it comes down to you. Now that we know so much about it and that it can present in different ways, any kind of change in some part of your body that you notice visually, or you feel a lump or a change, you need to go get it checked out. That would be the one thing I'd say is a huge game changer, because diagnosing it in an early stage, the survivability rates on breast cancer are very high now. Early stage diagnosis, stage 1 breast cancer, 99% survival rate. So that would be the main thing. And then as difficult as it is to gather all the information, I do think it's important to play a part as much as you can in the decision making about your treatment, because I think it's empowering, and it does make a difference to take that active role and learn as much as you can. I've seen some people who find that that's a way to regain a sense of control about their lives. My new mantra was, when my feet hit the floor in the morning, was thank you for this day. That every day that comes is, and I know that sounds a little cliche, but cancer, other things you face in life that are really difficult and challenging, I think it's kind of like you look around a corner into the shadows. And not everybody gets that view. It's kind of a special view to be able to look down into the shadow and see, oh, okay, what could happen here? You know, maybe my life wouldn't have gone, you know, past the age of 50. Maybe I wouldn't have seen my children, you know, go on and with their lives. And so once you have a taste of that, no matter what brings it to you, I think you can't help but feel like, oh, it's a game changer for you in the way you think. 20 years ago, we didn't have what we have now in the way of broad sense of awareness. 30 years ago, they wouldn't say breast cancer on television. You know, Betty Ford had a women's disease. I think you really have to credit women for speaking out and starting to walk. I mean, Nancy Brinker started Susan G. Komen because her sister Susan died at 36 of breast cancer, and a young woman with a young family. And that's what inspired Nancy Brinker to start this movement that was a game changer. She did the first Race for the Cure. It was just a little walk. And then now it's, you know, worldwide. I think we're all trying to get it right, all these organizations and the research. And on the most part, the messaging is, our messaging has really changed in Komen. We've changed it to know what's normal for you. That it's not just about getting that annual mammogram and a clinical breast exam, although we think those are absolutely important, but it's also the woman knows her breasts the best of anyone. If she knows what's normal, she's going to notice any kind of change. And to us, that's a first line of defense. To me, it's an exciting time in cancer, and I think all of the doctors working in it, surgeons and oncologists feel that way. There's a real excitement to what's happening in cancer research. And one thing that's coming out is it's becoming more individualized, as they are able to isolate these gene mutations and figure out which ones may correlate to which cancers. And there are going to be more ways to look at our risk factors. We're going to know more about whether you're going to be at a higher risk and if you should be screened more frequently than someone else who's at a lower risk. So I do think it's going that way. We have these targeted therapies now that treat a very specific type of cancer cell, and that's pretty exciting. It's not just, you know, the same chemo for everybody. There are exciting, very individualized forms of treatment now in cancer, and I think it'll continue to go that way, and we'll be able to treat things more specifically with less collateral damage. Yeah, so that even people who have metastatic breast and prostate cancer can go on and live much longer than they would have been expected to live even just 5 years ago. Here in Maryland, any woman can get a mammogram. And we have a very well-funded breast and cervical cancer screening program. And then in Maryland, it actually even goes over into a treatment program. Not every state has that. So any woman in Maryland can go in and get a mammogram screening and enter through the county health departments. At Komen, Maryland, we partner with those counties in a lot of ways to get information out, to do things together. Sometimes they're grantees of ours. They receive funding from us to further their programs with outreach workers and translation services, transportation help. So that's one thing I want women to know, that no one has to be afraid to go in and ask for that free mammogram. It's there and available. People who have insurance can be screened annually, but there can also be resources for people who don't have insurance. I think there's a lot of support out there, and you just have to tap into it. Our office is really good at helping people find resources. That's one thing we help people do in their area. We try to keep tabs on everything that's going on in all the counties and the regions of Maryland. So if they called the Komen, Maryland office, we would help channel them to services in their area.